And we are back talking with Dr. Tim McKnight. And Dr. McKnight has brought a guest this morning, so I'll let him get into that. But you want to talk about something that we don't really think about that often, or maybe even know about, right?
I don't think people know about this service we have in our hospital. It's a swing bed program. It's inpatient rehab. And people can qualify this based on several factors, but it allows for inpatient rehab, and they love it because they get good quality care. They get physical therapy, occupational therapy, and it's just a wonderful program. My father's been here a couple times, and April is part of that team that helps us get them enrolled and then works with discharge planning, and so she's been a blessing in our family's life. But the program is something that again, people aren't aware of, and we do a lot of rehabilitation for people who have had knee and hip replacements and other types of therapy where they're not quite ready to go home and be independent, and we get them ready to do that. So we just want the people in the community to know this is available, and it's a great service. And if you poll people who have gone through this program, they speak highly of it because of the one-on-one care they get.
Is this something that needs to be obviously referred through you or someone at the hospital then?
Yes, and typically they'll transition from a hospital stay into the swing bed program where they're getting their rehab. So sometimes they're transferred from other facilities, and sometimes they're from our facility. But when we determine that they're not quite strong enough or ready to go home and live on their own, we'll ask April to help us see if we can get these people qualified, and that's really what her expertise is. She's an RN too, so she's got that good clinical background to understand the need for this, and she's seen these patients as a nurse on the floor as well. But this is a great program, but we need somebody like April to help us get them into the program.
So April, welcome in. Thank you, first of all.
Thank you for having me.
Tell us about, I don't know, what your experience is when you first see a patient who is coming into this and how that progresses.
There's a couple different ways that they can come to us. So if they're with us at our hospital, our physical therapy does an evaluation, and we determine that they meet that criteria where they need that little extra help with some physical therapy, some occupational therapy. We also offer speech therapy, and we have doctors on staff 24/7, respiratory, lab, and if they need x-rays, anything like that, where we are full service to them still as a hospital. But then it starts the process. If they have an insurance that needs an authorization, we send it. We also accept patients from outside facilities that have had an acute stay in the hospital, or some of our patients will call and say, hey, I'm getting ready to have a hip replacement on this date. Here's my information. Can you look at it and see if I qualify? So there's a couple of different ways that we can get them. We also offer wound care. So if you have a patient that has a complicated wound healing process that might just be a little too much for their family to handle at home, I am wound care certified. And then Jen Thomas is one of our nurse practitioners. She's wound care certified. So we've got a couple of different angles that we can help them with that.
Yeah.
IV therapy needs, where they're going to be on a long-term antibiotic and there's no one available to help them at home, or it might be a little too much for home health to handle, then they can come to us during that time frame.
I'm sure there's no typical patient. Do you see more of some things than others?
Not usually. A lot of times what it is, you have an older population where there's an acute visit where maybe there's an illness or an infection like pneumonia or a urinary tract infection or something that has kind of just debilitated them a little bit, where they've gotten down and they just need that little extra time where they're getting that extra therapy and instruction to get them back to their baseline so they can go home and stay home.
Do you enjoy this line to see the people coming through and, they make faces, I'm sure, when they're in the therapy because it's going to hurt a little bit, but you have to get to that part to get well.
Yes. For me, this line of work is very rewarding because the end goal for the patient and for yourself is the same. You want them to go home. You want them to be successful when they are at home, so they get to stay home. They get to be independent as long as possible with their families, and you're just working toward that for them and helping them get there. And our patients are very successful. They seem to like our program.
I see part of that. Go ahead, Dr. McKnight.
I was going to say, one of the things that I like about the program is we really try to make them feel that they're not in a hospital as much as we can. So we allow them normally to wear their own clothes, their street clothes or their bed clothes, and most of the time they don't require IV access, so they don't have an IV line in. Sometimes they do, but most of the time they don't. They can get up and shower. They usually have nice, good-sized rooms, and they have somebody waiting on them with their meals. So we really try to make them feel like they're not in a hospital, and that helps a lot because there's something strange that happens in a small hospital room when you're ill, and that is people think they need to stay in bed and rest, and that's really the last thing they need to do. And so we encourage them to get up. Of course, when they have therapy needs, they have to have assistance and be with a therapist. But the worst thing that you can do in the hospital is lay in a bed all day. And if we can make them more comfortable and feel like they're home and that they just need a little bit more help, that really helps the mindset. And it makes it much more comfortable for them than just laying in a bed with an IV in and attached to all these different lines and things. So that's a really nice feature of the program, I think.
I'm sure you both see the mental healing of somebody who's able to start getting up and getting around again.
Yes. Well, and the nice thing is that we have numerous skilled nursing facilities, nursing homes in the area that do a wonderful job. But there are some people that to say that they are going to go to a skilled nursing facility, they automatically attribute it to a nursing home situation. And it can be kind of scary for some because then it's, am I ever going to get out of there? So the nice thing about us is that we're that in between where they're with us usually a week to 2 weeks. Some of them are a little bit longer. And then the goal of the swing bed program is they have to go home.
Yeah.
So there's no staying long term. There's they know coming into it what the end game is. And for some, that has been a good decision factor. The other thing is I want to clarify that we do accept traditional Medicare, managed Medicare, but we also accept commercial insurances. So anybody can come into our swing bed program. It doesn't have to be an older individual. It can be any adult.
Right. Yeah, well, that is good to know. Now, I see Dr. McKnight said that you're kind of a discharge planner. I don't know if that's an official title, but that was my first thought was, oh, that's good because the best thing about being in the hospital is leaving. So you get to kind of, I don't know, is that kind of a step-by-step as to what has to be done, a checklist, and then you can go home?
Discharge planning begins with admission. We look at maybe some medical equipment that they might need at home if they didn't previously have a walker, but now they need one. If they're on oxygen now, but they weren't prior to their visit to the hospital. And then some patients are going to need a little bit more therapy to continue that healing process when they go home. So then we set them up with home health. Home health comes in. We'll continue the physical therapy. They'll give them some skilled nursing, maybe an aid to help with bathing just until they're a little more comfortable at home, especially because some people have a step-in tub. They don't have just a shower or something. So we organize that and talk to them about what they need. We talk to them about family support, if there are other individuals involved that can help, if they have transportation needs for those follow-up appointments to the doctor's offices, we can arrange those. It's kind of a step-by-step process during their stay there that begins on admission, that at the end of it, it culminates into everything that they need to be successful at home. It's already arranged for them.
That truly is a lot of planning.
April's being pretty humble about this because from my standpoint, this is magical what she does because we meet every morning with the physician who is rounding as well as the nurses and April and the whole team. We meet and we talk about individuals and their needs and where they are with going home. And there's a lot of behind-the-scenes work that she does, making phone calls. I know when my father was there, boy, there was just so much working with my mother and trying to educate her and assess her needs as well as my father's needs as a caregiver. So it's critical that, a facility like ours has somebody like April to do all this legwork because without somebody with her skill set, it would just be very difficult to send people home with all that they need. And I know when my dad was in the hospital, he's pushing 97 now. he loved going to therapy. I mean, and I told him, as he's a former athlete, I said, Dad, you get to train some more today. And he'd go get on that bike, and today he's going a few minutes longer. And then he's having somebody come and help him with his balance and standing and getting up. And so the whole process, I think people get individualized care with the staff that helps them. And then, as you said, somebody that's helping you get ready to go home with all the services and needs that you are going to require is key. And I don't want to embarrass April, but she was so patient with my family during the difficult time. And so it takes not only someone with the skill set, but the right personality.
Mm-hmm.
And I think that's what these are the kind of people that make our program so useful, valuable, and so beloved by people who have been through it. So I can't emphasize the team approach enough, but the quality of people that are part of the Swing Bed program is excellent.
April, it's good to put a face on it too. So thanks for being here.
Thank you.
And a voice, I might say. So,
Right.
Is there anything else we should know? Can people ask for this, or basically they need referred, but
Well, anyone can call in to speak with me if they call the main number of the hospital, or I also have a direct line that is 740-922-4506. They can call and they can talk to me, say, hey, I want to know if I qualify for this, if they have other questions about it, anything that, if they have a planned surgery coming up, or just general knowledge that they have more questions. Absolutely. Give me a call. If I'm not there, my voicemail will pick up and I will give you a call back.
very good. That's service. Dr. McKnight, thank you. I know
Thanks for
you're
having us today.
giving kind of a personal reference there, so we
Yes.
appreciate that as well.
You're
So
welcome.
thanks a lot. And remember, that service is available at Trinity Twin City Medical Center. And that is today's Talk with the Doc.